Hi, Dr. Scott Jensen here. It's St. Patrick's Day. When I drove to work this morning, there was a slippery sheen of ice across many of the roads because the wind is causing the snow to drift here in Minnesota. It was 10 degrees out, and it's cold. 11 years ago in 2012 in Minnesota, it was 80 degrees. One of my farming patients in this morning told me about how his family was mowing alfalfa. That was 11 years ago. And then he said to me, as he chuckled, he said, "Thank God for global warming, or how much worse could it be?" I thought that was pretty funny. Yesterday, I got a copy of a Wall Street Journal from May 29th, 2018. May 29th, 2018, almost 5 years ago. And I just wanted to comment on an article because we're hearing something about social isolation. We're hearing more and more about it. And I think it's appropriate that on St. Patrick's Day, we would talk about social isolation. Because when I talk to people about St. Patty's Day, what I get from them is a deep desire to connect. You've got Norwegians, Swedes, and Danish people like me that want to be part Irish. My wife is a full-blooded German. Today, we'd like to be part Irish. We want to connect. We want to raise a brew and welcome one another into our lives. But here's what they said 5 years ago, May 29th, in the Wall Street Journal. An article by David Blumenthal, and it said this: the high health cost of social isolation and how to cure it. Social isolation, almost the opposite of what most of us want to do on St. Patty's Day. Here's what it says: social isolation, a clear threat to patients' health. To be socially isolated doesn't simply mean dealing with the occasional bout of loneliness. It means being substantially disconnected from other people and society in general. Social isolation is bad for your health, and that is especially true if you are older. Social isolation can be treated. How? Connecting patients. CareMore, a healthcare delivery system, launched a togetherness program, building personal connections. The reason I highlight this article from 5 years ago, pre-COVID pandemic, is this isn't a new concept. This isn't at all a new concept. But yet we have people today seemingly flabbergasted or surprised by the damage that public policy has put in place by government during the pandemic that cost people dearly. People died. They died in some situations because of hunger, in some situations because literally despair. In some situations, it was a dramatic suicide. In many situations, it was a total disconnect where they didn't follow up with their physicians. Their Parkinson's disease, which had been moderate but reasonably well controlled, got out of, if you will, sync, and they died from Parkinson's disease because they couldn't function any longer. They couldn't feed themselves any longer, and they literally starved to death, potentially in the midst of plenty. These are all the things that happened during the COVID pandemic. And this isn't surprising. It isn't astonishing. And for those public servants who put some of these horrific policies in place, when they act like they're surprised or they hadn't thought that was going to happen, don't let them off the hook. Look them straight in the eye and say, well, what the hell did you think was going to happen? Social isolation. It's the opposite of how we're wired as humans. We may be introverts or extroverts, but the bottom line is we all need to connect with someone with some frequency. And when we don't, there is hell to pay. So for these public health policy wonks who put in some of these crazy, stupid lockdown ideas, for some of these people who absolutely turned patients' lives upside down, this is on you. People died and you should not be surprised. Think about it.